I'm Jim Dodson. I'm a personal injury lawyer. Our office is in Clearwater, but we represent clients throughout Florida. When someone suffers a concussion that causes what the doctor would label as a mild brain injury, the spectrum of how that is treated, it really varies greatly. Many people go to the emergency room, they're diagnosed with a concussion, but they're discharged without any recommendation other than to follow up with a physician within a certain length of time. They'll make no recommendation for treatment typically unless it's really, really significant. And a matter of fact, when you get to a neurologist or someone who actually understands the treatment and diagnosis of a brain injury, what they do and what they recommend is going to vary greatly depending on how the injury occurred, its severity, and what they're noticing in terms of your progression of symptoms. We've had patients who essentially had very little treatment, and we've had patients who, because of the nature of their injury, were given specific things to do to kind of help the brain recover. It's important to remember that the brain operates like a muscle, any other muscle in our body. The thinking has traditionally always been that that muscle needs to rest and be put at rest. Many times they would put people in a dark room, restrict the light, restrict activities, and certainly restrict mental activity. But this needs to be done under the supervision of a qualified doctor. If you have a brain injury or know someone who's been suffered a brain injury or a concussion after any type of injury or crash, you need to make sure you treat with a lawyer who understands exactly the significance and seriousness of handling these injuries.